Syncope and presyncope. Syncope, fainting, it affects 3% of men, 3.5% of women. Sudden transient loss of consciousness due to reduced cerebral blood flow. If ischemia prolongs, convulsions may occur. It is associated with postural collapse with spontaneous recovery. Presyncope, a sensation of lightheadedness and impending loss of consciousness without progressing to actual loss of consciousness due to the same mechanisms. Mechanism: it happens when you have a sudden, temporary drop in the amount of blood that flows to your brain. Syncope can happen if you have 1. Sudden drop in blood pressure. 2. Drop in your heart rate. 3. Changes in the amount of blood in areas of your body. If you pass out, you'll likely become conscious and alert after a few seconds or minutes. Types F syncope. We have 6 types. 1. Reflux, neurologic syncope 0.50%. 2. Cardiac syncope 0.15%. 3. Postural or orthostatic syncope, postural hypotension. 4. Cerebrovascular syncope. 5. Situational syncope. 6. Hypoxic syncope, postural orthostatic tachycardia syndrome, POTS. A very fast heart rate happens when you stand after sitting or lying down. Your heart rate can speed up by 30 beats per minute or more. The increase usually happens within 10 minutes of standing. 1. Reflex syncope, neurally mediated. We have 2 kinds. The most common type of fainting occurs when certain reflexes are not regulated, causing heart to slow down, drop in blood pressure, causing decreased blood flow to your brain. In reflex syncope, fainting is often preceded by symptoms such as 1. Lightheadedness. 2. Nausea. 3. Feelings of warmth. 4. Tunnel vision. 5. Visual blackout. 1. Vasovagal equals neurogenic. Most common cause of syncope, known as simple fainting, results from severe vagal stimulation due to sudden trigger like severe fear, pain, and trauma, leads to severe bradycardia, hypotension, pallor and sweating. 2. Carotid sinus syndrome. It results from pressure on hypersensitive carotid sinus baroreceptors located in your neck, e.g. certain neck motions, wearing shirts with a tight collar, or shaving. 2. Cardiac syncope. It causes about 15% of causes of fainting. Usually exertional, not accompanied by convulsions. Your heart isn't working quite as it should. Low cardiac output, so your brain receives less blood. Factors can cause cardiac syncope, including 1. Structural problems, ischemic cardiomyopathy, dilated cardiomyopathy, heart valve disorders, e.g., aortic stenosis, and acute heart failure, e.g. acute myocardial infarction, if damage greater than 40%. 2. Electrical problems, such as arrhythmias, whether tachy or bradyarrhythmia, Adams-Stokes attacks, abnormal heart rhythm, and conditions like Brugada syndrome. 3. Other conditions, such as a pulmonary embolism or aortodissection. Common characteristics of cardiac syncope include experiencing chest pain or heart palpitations before fainting, having fainting symptoms while exercising, or exerting yourself, fainting while you're lying down. Risk factors for cardiac syncope include being older than 60, being male, having heart disease, having a family history of heart conditions, or fainting. Three. Postural or orthostatic syncope, postural hypotension, postural orthostatic tachycardia syndrome, POTS. Due to a drop in blood pressure when you stand up due to the effects of gravity, by at least 20 mm of mercury, systolic, and at least 10 mm of mercury, diastolic. Normally reflex vasoconstriction of blood vessels of lower limbs occurs on standing to prevent pooling of blood in lower limb. This is mediated through sympathetic stimulation. If defective, blood pressure will be markedly lowered in the standing position, postural hypotension, and syncope occurs. Causes can include hypovolemia, dehydration due to vomiting, diarrhea or blood loss, Alcohol use, hyponatremia. Medications, such as some blood pressure medications, antidepressants, and diabetes drugs, sympatholytic drugs, e.g. ganglion blockers and vasodilators. Underlying health conditions, lumbar sympathectomy, prolonged recumbency, elderly patient, huge varicose veins, weakness of the muscles OT the lower limbs, Parkinson's disease, left atrial myxoma, autonomic neuropathy, e.g. diabetes, or multiple sclerosis. Symptoms are usually preceded by warning signs that are commonly experienced before a fainting episode, however it may also happen suddenly without warning. 4. Cerebrovascular syncope, due to a problem with the blood vessels in and around the brain that can prevent the brain from getting enough blood, due to many uncommon causes such as 1. Injury from cerebrovascular disease, can include stroke, carotid stenosis, and aneurysms. 2. Basilar artery disease, a condition reduce the blood flow through the basilar arteries in your brain. E.g. vertebrobasilar transient ischemic attacks. 3. Steele syndrome, reversal of blood flow in the subclavian arteries that supply blood to your arms. Symptoms: feeling dizzy or lightheaded, headache, uncoordinated movements, trouble hearing, confusion. Risk factors: older age, cerebrovascular disease, cardiovascular disease, such as atherosclerosis, high blood pressure, or high cholesterol. 5. Situational syncope. Rare syncope occurs in susceptible individuals caused by activities, such as laughing, coughing, swallowing, intense emotional stress, anxiety, fear, pain, hunger, urination or defecation. 1. Cough syncope, tussive syncope. 2. Micturition syncope, I more common in old men especially at night. 3. Defecation syncope. Mechanism: straining, decrease venous return, decrease cardiac output leads to syncope. 6. Hypoxic syncope, decreased O2 content of the cerebral blood flow, e.g., Fallot's tetralogy, other cyanotic diseases or severe anemia. Symptoms of syncope includes blacking out, feeling lightheadedness, falling for no reason, feeling dizzy, feeling drowsy or groggy, fainting, especially after eating or exercising, feeling unsteady or weak when standing, changes in vision such as seeing spots, tunnel vision, headaches. The main differential diagnosis of syncope is seizure, while lightheadedness and presyncope must be distinguished from dizziness or vertigo due to non-cardiovascular causes. In patients who present with syncope, ask about 1. Circumstances of the event and any preceding symptoms, palpitations, chest pain, lightheadedness, nausea, tinnitus, sweating or visual disturbance. 2. Duration of loss of consciousness, appearance of the patient while unconscious and any injuries sustained. A detailed witness history is extremely helpful. 3. Time to recovery of full consciousness and normal cognition, current driving status, including occupational driving. In patients with presyncopal symptoms of lightheadedness or dizziness, ask about 1. Nature of symptoms and associated features, palpitations, precipitants for symptoms, like postural change, prolonged standing, intense emotion or exertion, frequency of episodes and impact on lifestyle, medications like antihypertensive agents. 2. Postural hypotension, a fall of more than 20 mm of mercury in systolic blood pressure on standing, may lead to syncope or presyncope. It can be caused by hypovolemia, drugs or autonomic neuropathy and is common in the elderly, affecting up to 1/3 of individuals over 65 years. 3. In simple faint, reflex syncope or presyncope, abnormal autonomic reflexes produce a sudden bradycardia and or vasodilatation. These may be triggered in healthy people forced to stand for a long time in a warm environment or painful emotional stimuli, such as the sight of blood. There is typically a prodrome of lightheadedness, tinnitus, nausea, sweating and facial pallor, dark vision from the periphery as the retinal blood supply, the most oxygenated sensitive part of nervous system, is reduced. The person then slides to the floor, losing consciousness. When lulled flat to aid cerebral circulation, the individual wakes up, often fushing from vasodilation and nauseated or even vomiting due to vagal overactivity. If the person is held upright by misguided standers, continued cerebral hypoperfusion delays recovery and may lead to a seizure and a mistaken diagnosis of epilepsy. 4. In patients with hypersensitive carotid sinus syndrome, pressure over the carotid sinus may lead to reflex bradycardia and syncope. Arrhythmias can cause syncope or presyncope. Most common cause is bradyuria caused by sinoatrial disease or atrioventricular block. Stokes-Adams attacks. Rate-limiting drugs are a common cause of bradyarrhythmia. 6. Supraventricular tachyarrhythmias, like atrial fibrillation, rarely cause syncope, whereas ventricular tachycardia often causes syncope or presyncope, especially in patients with impaired left ventricular function. 7. Mechanical obstruction to left ventricular outflow, including severe aortic stenosis and hypertrophic cardiomyopathy, can cause syncope or presyncope, especially on exertion, when cardiac output cannot meet the increased metabolic demand. 8. Massive pulmonary embolism can lead to syncope by obstructing outflow from the right ventricle. Associated features are usually apparent and include acute dyspnea, chest pain and hypoxia. 9. Cardiac tumors, such as atrial myxoma, and thrombosis or failure of prosthetic heart valves, are rare causes of syncope. Diagnosis. 1. Laboratory testing, blood work to check for anemia or metabolic changes. 2. Electrocardiogram, EKG, a test that records your heart's electrical activity. 3. Exercise stress test. There are many types of stress tests that involve you exercising or using a medication to stress your heart. Some types of stress tests will look at EKG changes or do an ultrasound of your heart. A stress test can also be done with nuclear imaging. 4. Ambulatory monitor. A monitor you wear that uses electrodes to record information about your heart's rate and rhythm. 5. Echocardiogram. A test that uses sound waves to create an image of your heart's structure. 6. Tilt table, head-up tilt test. A test that records your blood pressure and heart rate on a minute-by-minute or beat-by-beat basis while a provider tilts the table to different levels as you stay head-up. The test can show abnormal cardiovascular reflexes that cause syncope. 7. Autonomic reflex testing. A series of different tests monitors your blood pressure, blood flow, heart rate, skin temperature and sweating in response to certain stimulus to determine if your autonomic nervous system is working normally or if you have nerve damage. You may need other tests, including electrophysiology studies, autonomic nervous system testing, neurological evaluation and computed tomography, CT, scan or vestibular function testing to rule out issues in the inner ear. Treatment. If someone faints, follow these steps. 1. Check to make sure they're breathing. 2. Make sure they lie down or sit with their head between their knees for at least 10 to 15 minutes. 3. Offer the person cold water to drink. Treatment options will depend on what's causing your syncope and the results of your evaluation and testing. The goal of treatment is to keep you from having episodes of syncope. Syncope treatment options include 1. Taking medications or making changes to medications you already take. Midodrine, fludrocortisone, Astonin or Florinif. 2. Wearing support garments or compression stockings to improve blood circulation. 3. Making changes to your diet. Your provider may suggest that you eat small, frequent meals, eat more salt, sodium, drink more fluids, increase the amount of potassium in your diet and avoid caffeine and alcohol. 4. Being extra cautious when you stand up. 5. Elevating the head of your bed while you sleep. To do this, you can use extra pillows or place risers under the legs of the head of the bed. 6. Avoiding or changing the situations or triggers that cause a syncope episode. Avoiding standing for long periods of time, heat or emotional stress. Biofeedback training to control a fast heartbeat. 7. Getting treatment for structural heart disease. 8. Getting a pacemaker to keep your heart rate regular, only for certain medical conditions. 9. Getting an implantable cardioverter defibrillator, ICD. This device constantly monitors your heart rate and rhythm and corrects a fast, abnormal rhythm, only for certain medical conditions. The following table shows symptoms related to medications. Angina, aggravated by thyroxine or drug-induced anemia, e.g. aspirin or NSAIDs. Dyspnea, beta blockers in patients with asthma, exacerbation of heart failure by beta blockers, some calcium channel antagonists, verapamil, diltiazem, NSAIDs. Palpitation, tachycardia and or arrhythmia from thyroxine, beta-2 stimulants, e.g. salbutamol, digoxin toxicity, hyperkalemia from diuretics, tricyclic antidepressants. Syncope, presyncope, vasodilators, e.g. nitrates, alpha blockers, ACE inhibitors and angiotensin II receptor antagonists. Bradycardia from rate-limiting agents, e.g. beta blockers, some calcium channel antagonists, verapamil, diltiazem, digoxin, amiodarone. Edema, glucocorticoids, NSAIDs, some calcium channel antagonists, e.g. nifedipine, amlodipine.